what would be the pro of doing court-ordered therapy, even if you were
You still might have a good outcome.
You think so? You think that's a possibility that someone could get in and warm up to you?
Yeah. Oh, yeah. Oh, yeah. I've had that happen. I didn't love the experience anyway, and it wasn't somebody, but I think plenty of therapists have situations where their clients warm up to them, or they get some sort of, it's a new experience. It's why parents put their teens in. They think they know better. And I'm not saying the state knows better, but it's the same kind of rationale. We think we know better for you. Yeah. And what if therapy actually did help you, even if you didn't choose it? So I could also see that side.
The reason why I think about it more on like a systemic level, and how so often policy-wise, like we're pushing for people in the criminal justice system to get mental health treatment rather than go to jail. But then the flip side of that is forced mental health treatment.
We want to do we want to do
what I mean?
Yeah, we want to do everything for everybody but give them a job and give them money.
But I'm not talking about that. I'm talking about literally people who commit crimes, like drug crimes, like violent crimes are always going to go to jail. But like, there's still the thought process of like, if you do commit a violent crime, like, and you are going to jail, like, is part of rehabilitation doing therapy? Like, that's something that people are pushing. People are pushing when someone overdoses or is doing and selling drugs that they go to court-ordered treatment. Like, it's so interesting because I feel like most people in our professions would push on a systemic level for that to be the case. And yet when it gets down to the individual basis, it's really hard to provide treatment. A lot of people feel like ethical qualms with it. So it's like, okay, if we're not doing court-ordered treatment, what are we doing?
Well, what do you think?
I don't know. I don't have a great answer for it.
And I actually was going to ask that question and I stopped myself because I think it's a knee-jerk reaction.
It is. Well, Raquel brought that up when we interviewed Raquel Savage. She basically was discussing how, like, when you have conversations with people, it's a function of kind of like almost to cut your legs out and to ask you worst case scenario, because oftentimes,
right, like for example,
like the full solution.
Right. She had given the example kind of, when people talk about abolition and the police and things like that, well, what are we going to do with murders and rapists? And I feel like the question is similar in this case, not necessarily, but you actually don't have to know the answers, is essentially what she was saying. You actually don't have to have the solve. Anyways.
You can ask questions without having the answer.
You can ask exactly. And so I think for some reason I feel more, I don't know why, but when you talk about somebody who's court mandated, I think of teenagers. And I know that's not necessarily true, but I think who I run into most are teenagers. And I think the people that I hear about getting most referred are teenagers for some reason. And maybe that's the programs that I also just come into contact with the most. And so maybe I feel a little bit stronger about it, and that it feels a little bit more forceful with teens.
But is it?
I know. And so that's what I'm saying. I could go, as soon as you say a question, I'm like, yeah, well, I could see it that way too. Well,
because I just think about like when I'm working with small children in the hospital setting, like we are kind of coercing them into therapy. Like we really talk about conversations of consent, like how old are you when you can consent to therapy anyways, right? So I think like now we're getting into the weeds of it. But for me, I think it's just an interesting concept. I've only had one client who was court ordered because I only did outpatient for a year. And on like an internship basis. We did that internship together. But I had one adult who was court ordered. He was a man in his mid-40s who had no criminal record. He was a Black man. He'd been court ordered to get an assessment, and my assessment was going to decipher how much therapy he needed or didn't have to do. This. Yeah. And he had one violent incident that involved somebody who caused harm to his daughter, and never had one again, and never had one before. And I didn't order him to have any therapy. Like, it was none. Because in my opinion, and I don't know if this is right or not, but in my opinion, I feel like just because of the way the world I'm in, which is inpatient, the only way that we force anybody to do anything is if they're a danger to themselves or others. And I didn't think that situation actually proved he was a danger to others or himself. And so it kind of felt wrong to court order therapy. That's how I felt. My supervisor was pissed. We fought about it. We fought very hard.
I think you're right. And I remember our supervisor arguing with you about it. And I think he was wrong and his rationale was wrong. I could see that from an outpatient perspective. Excuse me. I think if I'm thinking about this might be a little bit of a reach and it might be a little bit idealistic and might not really happen. But I think my hope would be that maybe he could use that space for him.
Yeah.
And that maybe, you know, it sucks that it's court mandated and it sucks that maybe he doesn't need it in terms of like helping his anger issues. And that sounds really traumatic to have to be kind of like accused of this thing after just defending your daughter and having to go up against the justice system. And so he also maybe could use the space to like talk about that too if he had a good therapist. But the hope of that is really, really high. So I just,
Let's say that all worked out. Let's say that was 100% right. I don't think that outweighs him missing appointments and him being thrown into the system.
Oh, completely.
Like,
completely. Yeah.
The downside of him being mandated is if he doesn't do it, there's consequences.
Yes.
And that didn't sit right with me.
Agreed.
You're not unstable enough that if you don't go to therapy, that there should be consequences.
Agreed.
So that's kind of where I was coming from. And this is another interesting kind of diversion with therapy, but it was a Black supervisor, it was a Black client, and it was me. And my Black supervisor basically was like, I went really easy on him with his diagnosis. And my Black supervisor was pretty much like, you just did that because you felt sorry for him. Like, you're trying to be nice to other Black people. And I actually think he qualifies for a much heavier diagnosis. And my argument was, I basically diagnosed him with something that said that he was having a reaction to the situation. Nothing was inherently wrong with him. And my supervisor was trying to get me to diagnose him with something was wrong with him.
And you go lower anyway unless you really want somebody to qualify for services.
Yeah.
Like, you're not really needing to...
I'm putting this up on screen. This is from Harvard University.
Oh, cool.
And so this is some stats on it. And I haven't even read through them yet, so I don't know what they say, but I just grabbed it.
Let me see.
It says arrest rate falls, employment rate rises after treatment.
Wow.
At the 1 year and 5 year follow-up, mandated patients show arrest rates similar to those of non-mandated offenders and non-offenders patients. So it data shows similar results as...
Oh.
And also, you know, I appreciate the statistic, and of course I like that. And also I wonder, like, you know...
Yeah, what...
Why is employment kind of the goal mark for like what is a successful therapy? And it's interesting that those two things are tied together, I think.
Well, that's funny because you said everybody wants to give somebody something besides a job. So wouldn't therapy be successful if it helps somebody become employed?
I would, but I also think, to your point, this is so funny. I didn't even mean to do this, but I feel like it's a hoop to employment, which isn't fair. You should just be able to get employment just because you want a job.
What?
What?
Shouldn't you?
No.
Why?
Like, what kind of employment?
Like a basic entry level something?
How about they work at your house?
What kind of what do you need somebody to come work on your, what do they need to have?
Well, if
besides like,
do you want me to sound
vouching
like a
for them?
snobby piece of shit? Because if somebody's coming into my home, I want to know their quality of character. But
I mean, no, but I mean, like, but I don't know what therapy proves for that, is what I'm saying. I'm not saying no references, just let somebody like on off the streets. My dad would say that, but I wouldn't. But I don't know what therapy proves to have somebody be qualified for a job.
I don't think
unless they're like blatantly unsafe, and in that case, I don't think they'd be in.
I just feel like when you think about employment as a metric, I think you would think of it as being functional.
Okay, same.
Like an indication of stability,
yes,
or something.
Yes, which I don't know if that's a fair indication of stability,
I don't know either.
But I feel like that would be the metric you were trying to uphold, is like that you can. You know, because I think a lot of people with severe and persistent mental illness
struggle
to maintain a job because you have to usually be consistent, which is really difficult.
I think you're right. You're correct. And I think about...
I'm trying to think of a job that just anybody deserves to have.
Bagging groceries.
Okay. But that's not a livable wage, is it?
No, but that gets into a different topic.
Do I think anybody should be able to bag groceries?
Unless you're like a chronic, like you can't like keep yourself clean, maybe.
This show is taking a hard turn towards communism.
Yes, finally. I'm just joking.
So here's the reason why it's hard for me to say that is because I hate to be that millennial, but I just feel like that's the Gen Z attitude, and like the people who have that attitude are usually like middle class.
Yeah.
And they're like, I should just like get a job because I exist, and like I should just like only have to work a certain amount of hours and not have to work hard, and I should be able to call in for mental health days, which is true, but like you treat it like a 6 day. You're actually sick. You don't do it all the time.
I don't mean it like that at all. I don't mean it like you are entitled to like necessarily like every single job just because you deserve, like, because you're living or something like that.
Yeah.
I think of it in terms of, like, like with your client, it sounds like he's, I don't know, I'm filling the blanks here, but like a decent dad and somebody who's devoted to like taking care of his kid and whatever. And I feel like, kids and like 1 or 2 or 3 bad interactions with a therapist is going to color something. And that could just be his own attitude. And that's not fair to him, like taking care of his children. I feel like you should get to have a job, even if you like don't pass like an evaluation with a therapist because they're whatever. And so that gets into the weeds way more too. But that's
he was
what I'm
going to
thinking.
the workhouse in a couple months too. So I was like, what's the point of therapy?
Right.
But no, I get what you're saying. I get the basic premise of like, if you are somebody who's going to be like a decent employee, like you should be able to be employed and your history shouldn't color that as long as you're like a safe human.
But it's also hard to know who's a safe human.
Yeah, can't pick that. But I don't know. I think like the court ordered piece is really hard because I think about people who have severe and persistent mental illness and don't think that they have mental illness, and we force them. Like I'm involved because I'm an inpatient in a lot of like court ordered medication where like we literally take people to court so that we can inject them with meds. So it's like this range of like autonomy.
That's hard.
But is it? That's the thing is like it sounds awful and it kind of is awful when you think of it from an autonomy piece. But then when I think about the fact that like every single week you're psychotic and you're not taking a med to treat the psychosis, you're doing permanent brain damage. It changes the dynamic, right?
Sometimes the cot is in jail though, and they pick that too.
There are plenty of people who would pick, I think, jail if it was quick and easy and done and over.
I know somebody who would.
Yeah?
Yeah.
But do they have mental health?
I don't know.
Oh. Okay. Anyways.
Are the forced
Oh, I meant to say they.
Are they forced medicating them? It is technically.
Yeah, it's forced medication. Yeah.
Yeah, it is.
Yeah. We can also force you to eat at the hospital too.
Like, hold on. Are you saying the treatment is medication, or I'm saying like, do they actually give you like lithium? Do they force you to take?
I mean,
drugs?
You could.
For what? For forced
court-ordered for court-ordered therapy.
Okay, yes. So, yes, yeah. Oh, yeah, no. It's not for court. So, we're talking about two different things. So, there's court-ordered therapy for doing like a criminal offense or whatever that they deemed is related to your mental health. And sometimes what they do is they bring people to be assessed by us. And then we'd say if it's part of their mental health or not, which is also something. And then what I'm talking about is like when I work with people who have psychosis, like schizophrenia, bipolar,
and they need
bipolar
medication
episode, and they are psychotic, so they're not in reality, and they're having an episode where they're not in reality for a prolonged amount of time, and nobody can convince them to take medications.
That's when they go.
We take them to court, and we go before a judge, and they get to defend themselves, but we tell them, we tell the judge. They're cutting out every other word I say.
Sorry, I'm like,
and then we tell the judge that why we think. The psychiatrist gets on and says why they think, and then yes, they force people to take lithium and stuff like that. But it's only if you're a psychotic. Because the thing with, and this is what I mean about the autonomy conversation, is like most social workers would say that's pretty awful.
But if you know somebody who's psychotic, you want them medicated.
Well, it's also just like it's permanent brain damage the longer you have psychosis. So the longer you're psychotic without medication, the lower recovery rates you have. You're less likely to go back to a version of what you were before. You're not going to be the same, but a version of what you were before, the longer you're psychotic. Like we've had
Say
kids.
that again? You're saying that's interesting.
So the longer that you are in psychosis, the less likely you are to return to normal.
Wow.
And so that's why it's a fight. Because it's
crazy.
And parents back us. It's not like it's usually us and parents against like a 17-year-old. Because it's they are like, they don't want to give it up because they feel like they're talking to God. I've worked with kids after they went on medication and they lost their voices, and a lot of them go through very deep depression because they feel like they lost their friend or they lost their power to talk to God. And there's a really high risk of suicide after.